webinar so that we'll have it for you for future reference, and we'll make sure that you all get the link to the recording in the next few days. It's very quiet, so I know you're all doing this, but if you haven't, please mute your phones by hitting *6. And then later when we open it up and you want to ask a question or make a comment, you can speak by just hitting *6 again. Welcome everybody to today's webinar, putting a dollar sign to it, the Friends Cost Analysis Template adapted for respite. We are bringing this webinar to you through our Arch Sustainability Learning Collaborative, but we have opened it up to all of you, to all the Lifespan Respite grantees and partners and members of the Arch Network, because we think it's an important enough topic and that interest would be broad enough to open it up to everyone. And we're really delighted that all of you have joined us today. We are expecting quite a few people on the call, so unfortunately we're not going to take the time to do formal introductions. Again, later, if you have a chance to speak or if you want to enter your name in the chat box, we're very happy to hear from you. Just let us know who you are and what state you're from. We will have time for questions, definitely at the end, and I'll leave it up to the presenters if they want to pause for questions during the presentation. But you can feel free to start typing them into the chat box in the right-hand corner whenever you would like. If you want to see the PowerPoint slides and the screen in full screen mode, there are 4 arrows pointing outward in the upper right-hand corner right above the slides. If you want to click on that to see the slides in full screen mode. If you want to download the slides and any of the resources that I did send around to you before the call, but if you didn't have time to do that or look at them, you can click on any of those documents under the Materials section in your right-hand menu. And when you click on it, it'll say Download File, and you can download it right to your hard drive. Finally, as always, I'm asking you to take a moment to check your email immediately following the webinar. That will direct you to a survey link so you can give us your feedback. I've also tried something else. We're going to see if it pops up on the screen right after we close out so that you don't even have to click on your email. We'll see how that works, and maybe we'll get a few more folks to give us their feedback on the webinar, and also any ideas you have for future webinar topics. We're always very grateful for your input. Just a couple of quick announcements about the conference primarily. The National Lifespan Respite Conference is going to be held in Buffalo, New York, beginning the evening of April 30th through May 2nd. Very important, early registration ends March 15th. So if you haven't registered yet, I would encourage you to do so because the registration rate will go up after the 15th. We also, if you've had any difficulty getting hotel rooms, we've been able to add a few more rooms, so go ahead and grab those up before those are gone as well. And for those of you who hadn't heard yet, we are doing an excursion to Niagara Falls the evening of May 1st. We're providing a bus. There is a charge for that. It's dinner and the bus trip to Niagara Falls for the evening. And you do have to register separately for that as well, register and pay separately. We did have a waiting list for a day or two, but we've now gotten another small bus. So there's still room on that trip if you'd like to do that. And then very importantly, please don't forget to mute your phones by hitting *6. I'm hearing some background noise. Thank you. If you are a grantee or a designated partner and you've received an invitation from me and from Victoria at ACL, please don't forget to separately register for that Lifespan Respite Grantee and Partner Learning Symposium. And if you registered for the Lifespan Respite Grantee and Partner Learning Symposium and thought that you were also registering for the National Lifespan Respite Conference, you did not. You have to complete 2 separate registrations. There's no charge for the Learning Symposium, but we do ask you to register so that we'll know how many people to have for lunch and how many training packets we need to have. And then lastly, I just wanted to let you know that there is an ACL Arch Data Workgroup call on March 21st at 1 p.m. That is if we can find one of you who's willing to present on your performance measurement plans. We'll go ahead and have that call. If not, we'll have to cancel it again. But we are inviting 2 or 3 grantees who would like to present a case study about their performance measurement activities for Lifespan Respite Grant activities. And this can be, talking about the outcome data you're collecting, the measurement tools you're using to collect them. We're pretty wide open on what you'd like to talk about as long as it's data measurement related and related to your Lifespan Grant activities. So if you'd like to make a presentation, please let me know by this Friday, March 8th. In the last 2 calls that we had of this group, we did hear from 4 states about their data collection strategies, and I think it was very helpful for everyone in the network to hear from their colleagues about the work they're doing in this area. And they're also always very willing to share their tools. So I encourage any of you who are the least bit interested to please let me know. Now I am finally pleased to introduce our speakers. I think most of you are quite familiar with both of these wonderful women. Casandra Firman from ARCH and from the Friends National Resource Center will be joined by MaryJo Caruso, also from Friends, to talk about some tools that they've developed for conducting cost analysis. And they've adapted it for respite services and are going to talk also about how you can use this specifically for some of your Lifespan Respite activities as well. And we all know that being knowledgeable about cost analysis and developing the skills to carry it out in a meaningful way can be a really important component of any sustainability planning effort that you're engaged in. And I know all of you are working so hard around long-term sustainability planning, so I hope that this will be a useful tool. I'm really looking forward to their presentation today, very grateful for their time. So without further ado, I'm going to turn it over to you both. Casandra, are you taking the lead?
Thank you. I am here, and I am ready, and I think MaryJo is too.
I am as well.
Oh, great. I'm someone who used to, many years ago, the older people in the crowd may remember that when you'd write a check, if there was no money in the bank, you'd get this letter quickly from the bank about insufficient funds. And back in the day when I was in college, that's how I balanced my checkbook. I would know that I'd gone over what I had when I got that notice. Now, also in those days, you didn't get in a great deal of trouble if you were a relatively honorable person and you would immediately put funding in. But this cost analysis the cost analysis materials that we are showing you today are for people like me, I think, and for people with a little bit more sophistication in how they manage and understand where their money is coming from and how it is being used. We're going to show you some very simple tools, I believe, that were developed to help us really track how our money is being used, how effectively and efficiently it is being used, and it gives us ways of talking about it so that we can share that information with others. So today what we're going to do, yes?
I'm going to just jump in there. I am someone who always balances my checkbook, and I find these tools will be even for the person who knows to the penny how much they might have in the bank, but they might be looking at how much their services are actually costing versus how much they're budgeting for them, or they might be a part of a larger entity or organization or part of a governmental structure where either some budgetary changes or cuts have to be made, and they need to look at what's got the biggest bang for the buck and what's the most effective, and having that information will help them advocate or better use their funds.
Right. So this is for the people on both ends of the spectrum and everyone in between. We wanted to, but Friends National Resource Center worked with the University of Kansas to develop some tools for really helping us programs do cost analysis. So for this morning or this afternoon for many of you, we're going to go over an overview of cost analysis. I will introduce you to the Friends Cost Analysis resources that were developed by the University of Kansas with Friends. And then we're going to demonstrate some of the materials that we actually worked with the University of Kansas staff to adapt for respite programs. So you're going to actually see a live demonstration MaryJo and I will do for you to show you how they are used in real life. Before we get started, I'm wondering where everyone else falls in this continuum between MaryJo and me. So, Emily, will you go ahead and run this quick poll?
Will do. Let me get it up.
I'm assuming that everyone sees it because I don't. So maybe...
Yes, it's up there.
Okay. So MaryJo, could you give us a quick overview of what we're seeing?
Sure, and results are still coming in.
Okay.
It seems like a majority of folks really know how much all of their housing expenses are. That's like housing, utilities, and other related costs. That comes in very high, almost 90% of the folks. 50% of the folks, if not more now, are aware of how much they spend on clothing, and around 45% each know how much they spend on dining out and transportation.
Okay. So we've got a group that are pretty much have some idea.
Yeah, we have a really good handle on some of our expenses, which might be some more of those what we think of as fixed expenses, like rent or mortgage. But when it comes to some other things that are maybe choices that we can make to either purchase or not purchase, like clothing, dining out, and transportation, we seem to be all over the place, and probably around 50-some% or less do we have an awareness of what those costs are.
Oh, good. Well, I mean, good and bad. Good because hopefully this tool, will be useful to you. So, what is cost analysis? I'm going to go ahead and move forward. It is a way of identifying exactly what the whole cost of providing a service is. So, what does it cost really? With the direct cost, which are those costs that go directly to respite providers and for respite services, and those indirect costs such as administrative costs, other overhead costs. And it also provides a more sophisticated analysis for cost avoidance and return on investment. And I'll talk about those terms a little bit more later. So that's what cost analysis is. What does it really cost to provide the services we're providing?
So we're going to look at where did these resources come from. As Jill mentioned earlier, these resources are from the Friends National Center for Community-Based Child Abuse Prevention, but they are cross-applicable to those of us who work with cross-age and cross-disability organizations. They were originally developed to help examine the cost analysis of those programs that do child abuse prevention. And as we know from the respite arena, it's really hard to measure the cost and cost savings of prevention efforts when we're trying to look at the money that we're front-ending into things in order to prevent something from happening. So Friends, through an agreement with the University of Kansas, developed a series of materials that will help an organization, whether you are a direct service provider actually providing respite or vouchers for respite or a state-level organization, collect the appropriate data to ensure that not only are you making an impact on those participants that you're providing services to, but that you're understanding the costs related to it, and then get an accurate cost for how much it really does cost to deliver the service, whether you're providing a volunteer-based respite or a fee-for-service or maybe perhaps some sort of service that's augmented with a variety of different funds. And then really look at then what's your return on investment. If we're investing this amount of money in family caregivers or in community programs, what are we able to appropriate this to say that we were able to get back for it? And then what are we avoiding happening, right? As a result of a person getting respite, what didn't happen that we would believe is more costly? And then we'll look at, well, was it actually more costly, or what does that all mean? So cost analysis, why do we do it? It is different from a budget. A budget is really what you're projecting when you get a grant or you're seeking funding. It's hopefully what some of us, probably some of us better than Cassandra, sort of keep in touch with on a monthly basis to understand how much we're spending if our spending is annualized over the course of 12 months. But more than a budget, it can be a requirement of a funding source or your organization to really have a handle on how much is it costing to provide the service. It does expand the awareness of what you're bringing in terms of revenue versus the cost. And it can get even as granular as knowing the dollars per unit or per hour of service. Money, cost is a metric everyone understands. When you go to Starbucks and it costs $4 for a cup of coffee, we understand that cost metric as opposed to maybe brewing a cup in our own home for 25 cents. And it also then really does provide the opportunity to give not only continuous quality improvement, but to also look at the value of the bang for the buck, especially within the context of scarcity. And what I mean by that is you can have two programs. They're both the same type of respite program. They're both providing the same service for the same frequency and dose, let's say 1 hour per week, so 52 hours per year, and they both have the same budgeted amount. But one program is serving 50 families, and the other program is serving 5 families. Are the outcomes the same? And we know that if it's the same service, comparing apples to apples, serving 50 families for that dollar amount is a better bang for the buck than maybe that program that is serving 5. So cost analysis is one of the ways that you would come to that information to be able to make those comparisons.
Thanks. I'm going to show you quickly where you can find the Friends Cost Analysis Toolkit. And keep in mind, even though Friends is the National Center for Community-Based Child Abuse Prevention, these materials are applicable across multiple programs, including lifespan programs. So I don't want you to be put off by that, and you will see that we have adapted materials that are very specific to respite and can be used across the lifespan. So basically, if you go to the Friends website, you'll see collaboration. Under collaboration is activities that support collaboration, and then cost analysis. So that is the chain that you would follow if you're looking for these materials. When you get to the kit, this is what you're going to find. When you open that up, you're going to find a lot of information about cost analysis and a number of different resources, some of which we will be sharing today. And that brings us to another question. We want to know, if you're going to use this toolkit or other tools, what sort of cost do you want to analyze? Emily has another polling question for us. So do you want to look at the cost of running a coalition, cost of units like hours or days of respite that providers, of respite that's done by providers in your network, cost of provider training, other. So please fill out this polling question. What do you want to analyze? And I'm going to rely on MaryJo to tell me what the results are here.
Sure. So we're going to give you a couple of moments to click, and you may have more than one area. So you can click as many as are appropriate to you. If you are, and I do notice that 3 people had clicked other, we would like you to either type that in the chat box to your bottom right, which would be most helpful, or if you're not on the if you're not able to do that, you can unmute yourself and let us know. But right now, what we're looking at, Cassandra, is 72% want to know the cost of provider training. 64% want to know the cost of units of service, hours or days of respite provided by the providers in the network. 46% want to know the cost of running a coalition. And in the chat box, we're getting a few things typed in right now. One, the administrative costs of running a respite program. The cost of data management is another request. And as people are continuing to type in, we're going to keep moving. Another request is the cost of running a voucher program, such as the case management of respite services. So that just goes to show that our costs we want to analyze are really a wide spectrum, and the need is for everything from the very global coalition down to how much is it costing us per hour.
Wonderful. I think what you'll see is when we do the demonstration, you're going to see how you can actually apply this template for pretty much everything you just mentioned, MaryJo. But we'll look at it as we get in there and we can discuss that. Thank you so much for that. I want to take you to what you're going to find in the Friends Cost Analysis materials. There are 2 books. The first one is Step 1, and it talks about the importance of creating stakeholder buy-ins. Or if you're going to do cost analysis work, you need all the folks in your team engaged in it, including in some cases care providers and caregivers. It gives information on how you can collect the data and how to communicate and use your results. So creating stakeholder buy-in, the information provides how to discuss the whole process with service providers and other stakeholders. It also gives you some nice talking points to explain why you're doing data collection related to cost to families and other stakeholders. It also will help you identify how you're going to analyze and report on your data, and it talks about the importance of protecting confidentiality and establishing clear parameters for data access. It also talks about where you can find existing data sources. Rather than having to ask people the same questions over and over again, quite often you will already have cost data, for example, in your budgets, but you may have different places that you can access data. It also talks about ensuring that all costs are accurately and fully representative. And it talks about the necessity of identifying outcomes you currently or would like to measure. I noticed Jill talked about the importance of people asking folks to participate in a call on performance measurement and how they're measuring performance. If you are doing that, if you are actually collecting outcome data on your performances, you can then connect that to cost outcomes. We were able to achieve the following outcomes, and this is what it costs to get there. So I think it's really important that you have outcomes that you're measuring so that you can attach that to a cost later on. That's very important. And then it talks about how to communicate your results. So there's lots of different information provided in this guidebook on how you talk about the results. And I'm just, rather than reading this, I want to take you to the last bullet, because I'm going to give you an example which it really resonated with me, and I hope it resonates with others, but using social math as a way to communicate numbers meaningfully. I can look at numbers, and a big number doesn't necessarily look bigger to me than another number that's only 1 or 2 zeros off. That doesn't speak to me that well, but I'm going to give you an example. Social math. This is when you take something very tangible that we can all see and visualize and apply it to some numbers. MaryJo and I spent some time talking about what it costs for providing respite in Pennsylvania and what it might cost if a family were in a nursing home. So we've, by the way, on the internet and in your slides, I'll show you where we got, or you'll be able to see in the notes where we got the data that we're using, but it's we can get it by state. But the average cost in Pennsylvania for a nursing home placement is about $111,324 a year. But let's say that a family, and hopefully we'll be able to demonstrate this with our performance measures or our outcome measures. Let's say we have families that could have put off that placement had they been able to access 10 hours of respite at $23 an hour. And the $23 we also took from the cost of providers in Pennsylvania. So you can see this, the jelly beans on the left are what it would cost for a nursing home placement. The jelly beans in the center is what it would cost if we provided this family with 10 hours of weekly respite. And as you can see, that's a lot of leftover jelly beans. So this is an example of how we use social math. MaryJo, would you like to expand on this? Because you and I had lots of discussion about what this could mean.
So sometimes the pushback we'll get when we use this social math example is, well, not everybody needs to go into a nursing home. Or, and with nursing homes, we're looking at 24-hour care versus some support that goes into a family caregiver's home in addition to some other things. And while this is incredibly relevant to show us the small, minuscule cost of respite as compared to comprehensive 24-hour care, I also want to provide you with another opportunity of an example of times when respite can, and the lesser cost of respite, can support us to provide services to families who really need it, but might be accessing a more expensive service because that's what's either available or fundable. And in the case of Pennsylvania, where we're looking at a nursing home placement of $111,000 per year, and then looking at that cost per hour of services at $23 per hour, which is consistent with what a home hab aide or a home habilitation aide might get. A lot of times, families who access therapeutic staff support services in the state, what they're really seeking when they're getting therapeutic staff support is respite. However, due to the nature of the way our therapeutic staff support services are set up in Pennsylvania, it is required that that time is 80% teachable time. So let's look at an example of a child with autism or developmental disability, and the family is able to access 16 hours of therapeutic staff support per week. That sounds wonderful on paper. However, what the family really needs is maybe 8 to 10 hours of therapeutic staff support and the rest of the time in respite. However, that respite isn't a fundable service. And as a result, they're receiving therapeutic staff support where they are required to have teachable time. So the family caregiver, mom and dad, can't go to the grocery store during that time, or go and cook dinner unless it involves the therapeutic staff support worker and the child, because it's supposed to be teachable time, teaching not only the child how to support and manage their behaviors, but teaching the family caregiver how to support and engage in activities while supporting their child. Well, I was sharing with Casandra earlier, I don't know about your experience, but going grocery shopping with my children was never something I would have called a teachable moment for me, unless it was a teachable moment in terms of humility and in terms of what I could and could not control, which was clearly the amount of groceries going into the cart, the amount of things I was purchasing that at the end I didn't really need. There are times when I just needed a break to go grocery shopping or to attend to other things or whatever I defined as meaningful use of time. But in the scenario where families are given a fundable and more expensive service of therapeutic staff support and yet really want respite, they're in a quandary. And what we found is a lot of therapeutic staff support providers were actually allowing families to go and do those things that they needed to do without it being a teachable moment, and actually were providing respite. However, they were providing it at a rate of around $28 to $32 an hour versus the $16 to $23 an hour it would have cost for respite care. So in this case, the social math was really not only effective at showing us what families really needed, but what more costly service we were putting in place of that due to some of our funding structures and restrictions.
Thanks, MaryJo. The other thing I like to point out is there's a lot of leftover jelly beans. If respite could offset and prevent a nursing home placement, there's a lot of savings left over that could be used for other support services to other families or to that particular family that may need additional supports in the home. I'm going to give an example. Yes?
I was going to say if respite were an allowable service
yes.
at a less dollar cost, that's a lot more therapeutic staff support that maybe could be available to additional families or to be used in other ways. So that argument can be used whether we're looking at an out-of-home placement as opposed to respite or using respite as a more effective resource to families who are caring for their family members in their home.
Right. Another example I wanted to give on social math, and this is where these big numbers, so $12.7 billion, it's hard for me to wrap my head around that number. And that's the amount of money that in 2017 was spent on child protective services and foster care, the whole child welfare array of expenses. $40 million, or just under $40 million, is what went into prevention. And so I wanted to show what that might look like because the numbers are not speaking to me. But here, it's about 1/300th of a cent of all of this money actually goes to prevention. And so I wanted to use this social math example to help drive home the differences in those numbers. So the second part of the Practitioner's Guide to Cost Analysis is the one that...
Casandra,
yes?
I'm sorry to interrupt you, but there was a very important question.
Oh, please,
that came in when... Is that okay if we back up?
Please, please.
From Peggy in Colorado, and people are... Even back up one more slide to the nursing home example.
Yeah.
And again, I think that what we're doing here is just using an example. We really don't have any strong evidence that respite, and this is me talking, that respite will lead to not placing someone in a nursing home because there's so many other factors. So Peggy wants to know, how do you determine the consumer would have gone to a nursing home without respite? And this may be beyond the cost analysis question, but it might be worth just addressing for a moment.
Actually, this takes us back to the idea of having performance measures. We need, and again, I am using this as an example, and I am not saying that we can prove that a family would have gone into respite. But if you're collecting data from caregivers, and I know that ARCH has some tools where caregivers evaluation tools where they're asked, without this placement, would you have considered an out-of-home placement? And if you get people saying, absolutely, I would have done that. So if you actually could back it up with real data from families who said, this was my only option. So that's where you have to connect your performance measures, your outcome measures with the cost. You could never use the example that I have on the screen here unless you had data behind it. We have the cost data from Pennsylvania. We would also, if I were using this in publicity material, I would have to be able to say 40% of our caregivers said that without respite, they would have placed their family in a nursing home. So you'd have to have the cost, and you'd have to have the outcome data as well. I hope that makes sense. I just wanted to use this as an example. And in fact, bringing us to the Practitioner's Guide to Cost Analysis Part 2, in this part, it will talk about that. It will talk about connecting outcomes to your costs. And you can't do that cost avoidance share cost avoidance data unless you have some pretty clear outcome data and some good data about actual costs that you hope you have avoided. So the Practitioner's Guide to Cost Analysis, Part 2, it talks about what do we mean by direct, indirect, and in-kind costs. It shows you how to calculate costs for the actual service delivery, calculating cost per outcome, calculating cost avoidance, and readiness assessment decision tree. Now, the readiness assessment decision tree is the last page of Part 2, and you can all access that from the Friends website, and it shows you the steps you need to follow as you start planning your cost analysis. I'm going to skip through this because I'm realizing we're going to run out of time if I don't get to the demonstration. But really quickly, it's really important that if you're connecting cost with outcomes, it's very important that you distinguish what you mean between outputs and outcomes. So outcomes are those changes that we see in families as a result of your services. So for example, an output could be that I offer training. So I'm actually providing training to providers. An outcome would be that I've actually connected. There's now a change. Providers are actually going out and providing respite services to families. So it's really, you need to understand how to do that, how to choose outcomes that you want to track via cost and help, and it also provides information for calculating cost avoidance and return on investment. And now what I want to do is I want to show you how to use a cost analysis template. When you go to the Friends website, the Friends website will have 2 cost analysis templates, one in a PDF form and one will be in an Excel spreadsheet. We have adapted the Excel, and it is for respite programs. You get that template by downloading it from our resources on this webinar. So you're not going to find the one for respite on the Friends website. You can download it from our resources, and you can also, if for some reason you forget to do that and you want to do it later, just contact me and I will share it with you. But right now I'm going to show you how you use it with MaryJo. Let's see if this link works. Open. Yes.
And we're going to walk you through the process. Cassandra is going to ask me some questions and I'm going to share with her some real-time budget information from a program. This may not be the same as your program. You might say, oh, well, we don't put things there, or, oh, what about this cost? And they may not be costs that I have, or, may not be where you put things. Keep in mind that the categories that we're going to show you and walk through really serve as prompts. So you can choose to put some things wherever you feel, but if you are a statewide organization or a coalition or a grantee and you want to aggregate costs across the board, it's important that you share with your programs or your constituents what you're collecting in what area. So again, the categories that we're going to share with you themselves are simply prompts. You are free to put things anywhere that you want, but if you're going to aggregate the information, just like in any good data collection, it's very important that you share that with the local programs or whatever entities are going to be reporting back information to you.
Right.
So, Casandra, I'm going to turn it over to you to ask me questions.
Sure. Well, MaryJo, I'd like you to tell us a little about the program that you want to do a cost analysis on. So can you tell me who you serve, how it's being funded, and what you want to know from a cost analysis?
Okay. So this is a program where respite providers go into the family home, the family caregiver home, to provide respite for individuals with developmental disabilities. This is not a freestanding program. It is a program within a larger organizational structure that provides a multitude of educational and therapeutic and support services. So this is just one community component of what they do. These respite workers are all paid respite workers, and the families themselves receive 4 hours of respite care once weekly. So they have a rather prescribed frequency and dose of service from a paid provider that is facilitated through a program that's a part of a larger organization.
Okay. Well, thank you. And why do you want to do a cost analysis? I'm curious. What are you looking for?
We're looking at a couple of different things here. We're looking at what is the cost to run this program. As I mentioned, we're under a larger umbrella. So we wanted to know if, because there is a small fee for service for families, are we able to manage the cost within that fee for service? Do we need additional revenue in order to do that? Because we are a part of a larger organization, there's a lot of cost sharing that goes on. So it makes us as an individual program wonder whether or not we could go out on our own or whether we should stay underneath the umbrella. It also makes the organization wonder whether it is not whether or not it's cost effective to keep us at a time when limited funds are available. And we're also informing our state government. I mentioned the example earlier regarding therapeutic staff support as to we're collecting some data and comparing that with the cost as to whether or not our respite services would actually be at a cost savings to some of our state supplemented services because families really need the respite as opposed to the more higher and costing services that they are actually getting. And sometimes, and through our data, we're able to see this, actually misusing those more costly services as a respite provider.
Thank you. Well, let's start with just looking at staff. And right now what I want to do is look at those direct staff costs. So actually, I see.
Yeah. We've got a program director who spends 50% of their time working in this effort at a rate of her annualized salary is $52,000 per year.
Okay. So what I did is I put in 50% of her time, program director, and you're paying her 50% of it. So we've got $26,000 here. What other staff do you have?
So we've got a program coordinator scheduler at $42,000 per year, and 100% of her time is dedicated to this program.
Okay. So as you can see, as I type in the staff, the cost, and the percentage, it's beginning to do the calculations for me right here. Okay, what else? Who else is your staff? What are they being paid?
The actual respite providers. They are hourly workers, and that's important.
Okay.
Because they're not getting any fringes. The total is $137,200 for them, and we have enough staff that it is the full-time equivalent of 5.5 FTEs, although we do not, we do not pay them any benefits or things like that.
Okay.
They are hourly staff. So the other thing I put in this area, and this is, again, the art and not the science, the categories are prompts, are my fringe benefits. For that program director and coordinator. And their fringe benefits are prorated by the larger organization. They are determined by the organization, $17,400 in fringe, and that's 100% charged to this program.
Okay.
And that's
okay,
all.
So there we've got the staff.
Right.
Okay. Let's talk about program materials. What are you spending? What kind of program materials might you use that are directly related to respite?
So I have marketing materials like brochures in order to recruit families at $275 a year, and 100% of that is charged to the program. Because I am part of a larger organization, I have some internal printing costs at $500 per year, and 18% of that is charged to my program. And then I have mailing. Anytime I have to hard mail anything through United States Postal Service at $150 a year, and 100% of that is charged to my program. And I will pause here and say, because my program is in the family home, the family caregivers are providing things like food, any personal care items, diapers, activity or craft items, things like that. But if they were not, I would probably put some of those costs right here under program materials.
Okay. And I'm also going to stop here for a moment and point out that if I were looking at my coalition, for example, I might have other expenses that would go in here related to the coalition. It could be, it might still be printing and mailing, but you can attach different costs depending on what it is. Right now, we're looking at the cost of the total operation of running this respite program. But you can see that this could be adapted for different areas. Let's go to project-specific technology.
So I've got internet and phone.
Okay. And the reason this is direct service rather than indirect is because you have to call the caregivers, set up appointments, and that sort of thing.
Right, and it costs us around $960 per year for that, and 100% of that is absorbed within my cost.
Okay.
And then I have some equipment maintenance related to, internet, phone, computer, things like that. And again, we need those items in order to do the work. That's $256 a year. 100% of that is going towards my program. And then I've got a computer and technology allowance of $1,200 a year. And obviously, I'm not buying a new computer every year, but I don't want to buy 10 new iPads or computers, at a given time. So I do it on a rotating basis and allow myself around $1,200 per year at 100%, so that my program coordinators, directors, and any direct staff workers that need to manage their information on the computer will have access to that technology.
Okay. Now, do you need to give them money to get out to, or the providers to get to the caregivers' homes?
Well, we do provide mileage reimbursement.
Okay. What is
and we
that?
Provide that to the federal rate. $15,250 a year goes into mileage, and the program is charged 100% of that cost.
Okay. Do you do any incentives for families?
We do. We do gift cards for staff and family recognition. It may be staff that have achieved longevity, families who have done some public speaking for us or outreach or assistance and engagement. And we do about $450 worth of gift cards per year. And 100% of that cost is attributed to the program. I also, as an incentive, purchase promotional items, family promotional items that support the engagement of families in our program, because we know that engaged families tend to stick around, and that's $250 I spend per year just on small items with our phone number, things like that, and 100% is charged.
Okay. Now, is there anything else that you're spending that you would say is direct service?
Yes, and this goes into my provider training. We do CPR certification. I do several per year at $400 per time, and 100% of that is charged to my program, and that's for individuals who don't come to me with CPR. So I know how many people per year I need. Everybody 100% needs certified, and there's a certain percentage that walk through my door that already have that certification.
Okay.
And then universal precautions and safety training typically costs me $200 per year. And I'm only charged 18% of that because that's a part of the benefit of the overhead of being a part of a large organization. Same thing with staff development, $250 a year. Cultural competence training at $200 a year. And again, all of those are at a portion of the cost of being a part of a larger organization. And then finally, I have professional memberships. And for us, that would be something like a membership to Arch. And we put this under this area because we want our specific arm of the organization and our direct service workers to benefit from the knowledge and expertise of any of our professional memberships. So we consider that a part of the cost of being involved. And that's 100%.
Yeah, and here's an example. This could be, some people might consider this an indirect cost, and so they might put it on the other column. But this, as MaryJo said, this is an art, not necessarily a science. The math will all work out in the wash, so it's okay to put it here. Let's go. So that's pretty much all of the direct costs. Let's look at indirect costs. What are your indirect costs? These are the costs to run the agency that are not necessarily related to the direct service. So what are your...
Our program coordinator and director report to the chief operating officer, the administrator of the larger organization. She's got a salary of $85,000 a year, but only 5% of that is charged to this program because she's overseeing many, many programs. We don't have anybody else under administration, but we do have administrative staff, and that would include our clerical staff at $32,000 a year, and we are charged for we're small enough that we're considered to be 5% of the overall organization.
Okay.
They do not charge us for any other staff, but when we go down to technology and equipment, again, as a part of a larger organization, we have computer maintenance, but we have contracts that serve the entire, the entire umbrella organization. So it's around $1,675 per year, but we are only charged 5% of that.
Okay. So, and I hope everyone can see that as we start filling this out, you're seeing on the right-hand side what the cost for direct service is, the indirect so far. I'm pretty sure we're going to get down to in-kind, but let's go to facilities. Are you paying anything for your facilities?
We do not. That will fall under in-kind, but we do have program insurance that is somewhat different than the rest of the organization. At $2,624, and 80% of that is charged to the program.
Okay.
And then we have a required amount, $480, that we have to put in for office supplies, and the typical papers, pens, ink, things like that.
Yeah.
and 100% of that is charged to the program. And that's our training binders. Sometimes they're put, or some other things can fall into there. That's where, again, the direct, indirect. I just know that I get $480 per year for supplies, and I really try to use it.
Okay. Now, I just went ahead and pasted in all the others that I know you're doing, and I think this independent data review, can you tell us what that is and what it costs?
Yes. So we collect data every year, pre and post, based on our outcomes with some identified measures. We input all the data ourselves, but we want to have someone else take a look at it and give us some feedback on it. Somebody who doesn't have any skin in the game to either make us look really good or make us look more effective than we are. We want somebody to look at the data for what it is. And so we pay through a contract with an individual, and we've had it before with universities, an individual on an annualized basis to independently review our data for $300, and we incur the entire 100% because we're looking at that to really document the effectiveness and impact of our services. We have some administrative staff development expenses. We, like sending somebody to a conference, and we put in $750 for that at 100%.
And I'm not going to use professional membership because we put it in the direct column.
Our membership is more related to what we offer to our direct staff.
Okay. So workplace discrimination training, it looks like you pay about $200 a year. Does that go to?
And that goes, not $2,200.
Yep, I fixed it.
And we're only charged 18% of that as a part of being within a larger organization.
Okay, thanks. That brings us up to in-kind. So do you have any volunteers, any volunteer time that you can count?
Yeah, we have on occasion had some guest speakers and trainers come in to do some professional development of our direct service workers, our respite workers that are above and beyond the organization. And we always value that at, around $150 a year, and 100% of that is attributed to our organization to build their capacity.
Okay. Now, I'm just going to stop here and let you know that with in-kind resources, there are a lot of different ways of identifying this. There are websites, and they are referenced in the notes in the webinar, in the PowerPoint slides. But different places you can go to find out what a registered nurse, for example, what they would be paid in your state. So there are if you're tracking volunteer time, there are different resources you can go to get really good, credible rates that you can actually claim for in-kind. Sorry. I want to keep going.
And there are times when, if we do have a trainer or a guest speaker, somebody who's sharing their subject matter expertise, in any way within our program, we ask them what their hourly rate is, very similar to what Jill does with ARCH when we're filling out an in-kind form. So depending on whether they're providing a hands-on type of service where I would go, as you mentioned, to a website link and sort of look at what the cost would be within my state or my community, or I might ask the person themselves if they were charging for this service to come in and give a speech or some training, what might it be?
Okay, thanks. So do you get any donated materials?
We do. Even though the services take place in the family homes, we get a lot of sensory items and adaptive equipment that is either donated directly, the adaptive equipment. It may be that somebody, no longer needs it, but one of our universities creates a lot of sensory items for respite workers, and every worker is provided with a go kit to take into the home to engage in activities with the respite in the respite environment. And the universities anticipate that it's about $375 in materials that they're using.
Thanks. Now, you mentioned earlier that you use donated space.
Oh, yes, and I just want to step back. We don't count the students' time to create these sensory items because the universities are counting that time as a part of what they're doing. If they didn't count that time, if it was us coordinating the university group, I would count those hours of creating those donated sensory items under my volunteer time.
Right. So since the university's counting it, you can't double dip. But if they weren't counting it, you could go ahead and put them in there.
Right.
Great.
We're choosing not to double dip there. And then you were asking about facilities. Yes, our office space, which includes utilities, parking, and any storage space, file space, things like that, is all an in-kind, and it comes to us at about $15,200 a year.
Okay, and that's 100%.
That is 100% donated.
Okay. Well, we have, and probably we'd be able to think of other things as you go along and do this for yourself. But what we have for 1 year of running this program, the total cost, including the in-kind, is $266,675.15. So that, now if I'm doing this for my own program, I might go back and say, okay, that's what it actually cost, and then I could delete all of the in-kind. So people could see that that $15,000 of that is in-kind. So what we've done, though, is we've come up with a complete cost. Now, how much does it cost to provide an hour of respite? How many hours did you say you are actually providing of respite? And I'm going to put this in here. Total service hours. This is my units of service. How many?
Right. And we track that, obviously, because we know we're paying the workers. So we paid for 15,808 hours in the last
15,808 hours.
Mm-hmm.
So basically what we're finding now, the actual cost to provide that respite is $16.87 per hour. Now, are you paying for all of that money? Because do caregivers pay for any of it? Do they get vouchers? How are they?
So family members get, families are charged $10 per hour.
Okay.
And they can do that in whatever way that they can, on a sliding scale fee or, whatever that may cost them. But what we actually charge to families is $10 per hour.
Okay.
So that means the self-pay fee is around, we bring in revenue around $140,000.
So actually, it looks as if the adjusted cost per hour that is costing the agency is $8.01. Now, I've seen some questions coming up. I can't read them, but I know that there's some questions about what we're seeing so far. MaryJo or Emily, could you share those questions with us, and let's see if we can address them before we go to the next page?
So one of the questions is analysis including the number of care receivers served. I do know how many care receivers I served. I was collecting the total number of service hours in this example. But if I didn't, if I wanted to look at it another way, I would look at, we served 58 families in the fiscal year that we are looking at the cost of. And so if we looked at that, we would know that it cost us around $4,500 or so dollars, $4,600 per family per year for them to get a year of respite. And then we also, but in this example, we wanted to know the cost per hour. But yes, we could have analyzed it by the number of care receivers, cost per hour, or both.
Yes. So basically, I could find change my unit. Right now, my unit is hours, but I could also change that unit to caregivers. and I could divide the total cost of services by the cost of caregivers, by the number of caregivers. So I can actually change this formula, not the formula, but change the form and look at it that way. And if anyone has questions about how they might do it, if you're not really familiar with Excel, I'd be happy to adjust it to fit what you are really looking for.
So, Cass,
are there any
there's
other
question? Yeah.
Sure.
Which is, why are the in-kind resources not automatically subtracted from the total cost instead of added to the total? And there's a very good reason.
Go ahead.
So go ahead.
No, you go ahead and give the reason. And I was going to show how you can get rid of it.
Yeah, it's the true cost of providing the service. If I didn't have the donated facilities, I would have to go out and purchase those. It's important that I know how much that would cost me to do that. The same thing with sensory items and some of the other training that is provided. So we're looking right here at the true cost of service, and then we can look at what it's, the actual cost of service. And Cass, if you want to give...
yeah, let me show you what I'm going to do. So I want to know the true cost. So I'm going to put those in kind in. But all I have to do is highlight what I've just done here and delete it. And now I see that the cost without the in-kind is $250,000. So basically, by just deleting what I entered, or I could even open a new spreadsheet and just not put in the in-kind sources, I would be able to pull that out. That's the beauty of Excel. You can look at the numbers in a lot of different ways. But I want to look at revenue now. And are there any more questions before I move on to the next page? No? Okay. I'm moving to program revenue because we also want to look at where is all this money coming from? And can you tell me, MaryJo, exactly where are you getting your funding?
Certainly. So we received some federal funds through our state, the CBCAP dollars, the Community-Based Child Abuse Prevention dollars. We get $15,000 from our state CBCAP lead, but those are federal dollars that come in through our state Children's Trust Fund, specifically to go towards respite care. We then, and those are the only federal funds that we receive. We then get some funding through our state. And there are Health and Human Service funding. It's a line item in the general budget, but it is specific to Health and Human Service funding, and it includes any waivers and things that are state-directed. And we get $25,000 per year to that. And that's, and then we get some philanthropic funds. Oh, I see you have some volunteer things that you want to put in first. We estimate, that those in-kind volunteer resources, you pop those over here, and that was $15,000. The total of all of those things was, let me see. I'm going to try and flip back. Now, is this where you're pulling it off of the other side, Casandra?
Yeah, I could just go here and put it up here, but 150. So that is what we said before. So I'm just going to put it down.
Okay, and then the same thing with donated materials.
Yeah.
That was $375. And then the office space, $15,000.
Okay. And I'm gonna actually rush through this because I'm so afraid we won't have any time for questions. So I'm gonna put in office space.
Yeah, and we do have a couple of other philanthropic activities.
Okay.
Donor activities that I would also like to.
Okay. So others, philanthropic, what do we have here?
So we have some fundraising, some fundraising events, and private donations. So our charitable, both our private donors and our charitable events, even though we are a part of a larger organization, entities, anybody who's who chooses to donate can donate directly and indicate that they want the funding to go to the respite program. So in those areas, we have $25,000 for the activities, and we have 18,250 through a grant.
Okay. So that's your philanthropic. What about caregiver fees? You've already mentioned that once. And as I recall, it was $140,000, right?
Yes. Yes.
Okay. Are there any other sources of revenue?
So then, yes, there's one more. I think we do, and I don't know where we put this, so I want to make sure that we didn't lose this one activity.
That's a special event you do.
Special events, right. So we do special events at $25,000 per year.
Okay. So this is where the money is coming from, and you can see federal, $1,500, state, the in-kind, philanthropic, caregiver fees, and other. And it also has created a little chart so we can see most of our money is actually providing for the direct services coming from those caregiver fees. But we also see where we're getting federal, state, in-kind, and other funding. So if I were using this template, as you can see, I've been able to determine what it costs exactly per hour to provide respite services. I could actually figure out per family if I simply traded out the unit of service. Instead of looking at total hours, I could trade out for families or caregivers. And I could actually come up with an amount for the caregivers that I'm serving. If I were just looking at what it costs to train providers, what I can do is I can look at only enter in the information that is relevant to the actual training of care providers. And I would be able to come up with a unit of service, and it could be 1 hour of training. And I could use this to find out what exactly it costs for me to train a provider. So it's very adaptable. And it will be available, and if anyone has questions about how they could adapt it, I welcome your phone calls. I will be happy to tailor this for you to make sure that it works for you. I'm not going to be able to take you through all of those steps today because we will be out of time, but I wanted you to know that I am available to help you with that. Some rules about cost analysis, and then we're going to open this up for questions. Your denominators must match. So we need a common metric. For example, I'm not going to do divide by hours of service and families of service. I'm going to choose one or the other. So I need to have a denominator that is the same whenever I'm comparing pieces of data. And I'll go back to when I was looking at the cost of respite the cost of a nursing home placement versus the cost of respite. I needed to have a common denominator of the year. How much per year? I couldn't really compare hours of respite compared to 1 year of a nursing home placement. We had to have the same denominator. If you are arguing that you're saving money and you're showing a cost avoidance analysis, always choose the most conservative option. It's much better to overestimate the cost of your service and underestimate cost avoidance. So it never looks as if you're trying to promote your program in a way that would not withstand scrutiny. So always be conservative. And then document everything and all the sources of data you use, all calculations you perform, and decisions you make based on your cost analysis. Final thoughts, your estimates are as good as your data. Most cost analysis involve thoughtfully incorporating multiple sources of data. So the more complete your data are, the better your estimates will be. Don't let the numbers speak for themselves. Back to that social math, the 42 million versus 370 billion, for me at any rate, I need some putting that into a different format. Whenever you can, use social math. Make sure you contextualize your data. And keep in mind that your costs are investments, and find a way to convey what the funder or the community, what they are getting for investing in your program. So we're talking about costs. They are buying something that is an investment in the future. So find ways of conveying that so people understand why they're spending the money and how it is actually improving the lives of people. And I'm going to go to the last slide. Please contact us with questions. Call me. I've got MaryJo down here, but this is not MaryJo's job. She is just helping me today as a proponent and champion of respite and as a staff with the Friends National Center. But if you have questions about how you can adapt the materials further, please contact me. And I think at this point, MaryJo, unless you have something more to add, we can open it for questions. And I'm going to go back.
There are some questions, Cassandra, if we can jump right into this.
Yeah, I'm going to...
There were quite a few people who were talking about administrative costs, especially around voucher programs. And a lot of programs are spending a lot of time per family around the voucher, helping families find respite or fill out the application, or even broader administrative costs. I think there were some questions about how would we calculate that.
Well, I think I'm going to go back and share the template again, just so you can see this. Okay. And MaryJo, you might have some ideas here as well. But I'm going to change this to the cost per hour. I'm just going to right now change this to cost per family, because I can start looking at the cost it is per family to provide a service, and the total number of service hours. Remember, I have to have the same denominator. I'm going to have the total service families. So if I served a certain number of families.
So we're going to put that number in the box, and that number is going to be 60.
So I'm actually serving 60 families here. So it's costing me now $4,459 to serve 60 families, or per year per family. Now, if my program, let's say it's the scheduler, their time might have gone into, I don't know how they're using their time, but I'm making the assumption that part of that time might have been negotiating vouchers, helping them understand where to find and use the vouchers.
Correct. That person, 100% of their time is doing the intakes, doing the, voucher, either applications for different funding sources, or assisting families with their financial forms to see if they fit a sliding scale capacity, if their fees are going to be augmented by philanthropic funds. That's why that person is dedicated at 100% of the time, and they are assisted by the director who's spending 50% of the time on some.
So I think what you just need to do is know who is, the question, and I don't see the question, I'm sorry, but you need to know who is spending that time and what are their wages for working out the vouchers with families and making sure that that is represented here. Maybe the program director is doing 75% of her work because he or she has to spend extra time sorting out those vouchers. So that, see, you're going to have to change these numbers based on what the real time that is being spent on the vouchers. I don't know if I've addressed that, and if you want to go off mute and ask the question differently or help me understand exactly how you would like to use this template. Nope.
We had Ellie Billeman was asking questions, Linda Porter, Sharon Johnson about case management and administrative costs. Are they still on the call?
Linda's currently typing, and while she is, I'm going to go to Cheryl's question, which is, do you track in-kind volunteer hours for coalition activities? And if so, is the hourly for meetings based on a national, state volunteer rate, or is a professional rate allowed? And I know in my state we do track in-kind volunteer hours, and we do it at the I have seen it done both ways. We have done it at the professional rate. We have done it there is a national volunteer website where people can find either the national or the statewide value of a volunteer hour and or a little deeper, the statewide value of a volunteer hour for a similar job or role. And maybe, Jill, you can speak to why you have your volunteers submitting information for their in-kind activities with their professional rate.
Mm-hmm. And before then, I just want to add, that's why it's important that you document how you came across these costs. There are a number of different ways you can ask. You can use the resources that MaryJo mentioned. You can ask the people to provide information on their rates. There are different ways you can do it. Just make sure you document it. So if you're ever questioned about how did you come up with these numbers, you can show that that they're credible numbers and that you had a system that you used, if that makes sense. And Jill, I don't know if you were, yeah, go ahead.
I'm happy to talk to people about the volunteer hours individually or send something around. There are some federal regs that specifically say if the employer gives permission for the person to participate in your coalition, you can use their hourly rate plus fringe to count their participation. If it's other more mundane tasks and they're doing it strictly on their own volunteer time, then it's probably better to use the standard volunteer hours, which is something like $20 or $22 an hour. But Linda Porter has followed up, and so has Sharon. Linda says, she says it's difficult to track case management because it can take many forms. You need to tease out the administrative versus the client support. So perhaps her issue is how to do time work study in a role that is already quite stretched.
Well, I think the important thing is that you use the template in a way that makes the greatest sense to you. As you saw, MaryJo and I moved some items from direct to indirect. And it really didn't matter that much because the math all worked out the same in the end. So you can determine, as long as you're tracking the hours, and you have to have your own system for tracking the hours and the wages, you can put them with direct costs of staff. You could put them in indirect, just as long as all of the time and wage percentages are put in there. And it really is important that you figure out how many hours per week or what percentage of a person's time is going to case management, what percentage of a person's time is going to direct service. As long as you know those numbers, you can basically use this template in the way that makes the greatest sense to you. And again, it's the sort of thing that if you wanted to work with me and I could help you tweak this for those very specific questions you have, I would be happy to do it. I was sort of surprised when I was doing this with MaryJo. I was surprised at how great the cost was. I mean, I was thinking it was going to be a lot less, and that's kind of a risk you take. But it really helps you understand, is there a place we could cut costs here? Do I need to justify somehow the amount of money we're spending? But really, it really helped me understand what the true cost of providing respite was. And this is where it's going to be really important to look at whether or not there's some cost avoidance. If we hadn't provided respite, what were the costs of not providing it, and really seeing what those are.
In addition, I think it's helpful for organizations that are looking at funding respite or entities that are looking at funding respite to understand that even a volunteer program has costs. Just because the volunteers are not paid, it doesn't mean that the program is free. It means that their time is freely given, but there are also many, many related costs to running a program, running a coalition, et cetera.
So I think we're at the end of our time, Jill. If you have any closing comments, and please feel free to contact me. We could have gone into a lot more detail, but we would have never been able to do the demonstration. Please check out the Friends resources on cost analysis, and I am happy to work with anyone to help adjust this template for their needs. And that's all from me. Thank you, MaryJo, and thank you, Jill, and everyone.
Well, thank you both very much. I do want to point out that several of our state folks have connected with each other in the chat box, especially around these administrative cost issues. So perhaps maybe at some point we can do a follow-up call with those who are interested. I know on the Voucher Collaborative, people are very interested in learning more about calculating administrative costs in particular. So maybe we'll zoom in on that issue on another call.
And that gives you an opportunity to start tracking the actual time that is spent in voucher and working with vouchers.
Right. Well, thank you very much, MaryJo, and thank you very much, Casandra, for providing this. Folks have already said in the chat box that this has been a very useful tool and instructions on how to use it. And thank you also for offering to continue to be available to folks to answer questions about its use. If there are no further comments, we have reached 3:30. So I wish you all a very good afternoon, and thank you all very much for participating. Take care, everyone.
Bye-bye.
Bye-bye.